Measles and mumps. For a lot of us, those words bring up this kind of nostalgic feeling, right? Simple childhood illnesses, just a rite of passage. But what if that whole idea is, well, dangerously wrong? Let's dive in and find out.
So what if we stopped thinking of them as simple and started seeing them for what they are? Incredibly clever cellular invaders. And get this, what if the first clue they leave behind isn't the rash we all expect, but this tiny, fleeting piece of evidence? Something that only a really sharp-eyed detective, or, believe it or not, your dentist, might be the first to spot.
All right, every good investigation starts by identifying the usual suspects, or in this case, the family they belong to. Both measles and mumps are part of the paramyxovirus family, and this is a family with a reputation. They're known for causing respiratory infections that have a nasty habit of not staying put in the lungs.
So what's their shared MO, their modus operandi? Well, they're what we call enveloped RNA viruses. Now that just means their genetic code, their RNA, is wrapped up in this protective, kind of greasy outer layer. Think of it like a disguise that helps them slip into our cells undetected. And their game plan? It's brutally effective. They get in through your breath, multiply like crazy, and then go systemic. We're talking a full-body invasion. Okay, let's pull up the rap sheet on our two main suspects. Now, you can see they've got a family resemblance. They're kind of similar in shape, same RNA blueprint. But, and this is the crucial part, the difference is in their toolkit, specifically their surface proteins. See, both use an F protein to get inside a cell, but to latch on in the first place, measles uses an H protein, while mumps uses this slightly more complex HN protein. And that one little difference, it changes their entire method of attack.
So let's really zero in on that measles toolkit. The H protein, that's its grappling hook. It's how it latches onto our cells. Then you've got the F protein. That's the master key. It literally fuses the virus with our cell membrane, letting it just dump its contents inside. But here's where it gets really clever. That F protein has another trick up its sleeve. It can make an infected cell fuse directly with its healthy neighbors. This means the virus can spread from cell to cell completely undercover without ever having to go back out into the bloodstream where our antibody patrols are waiting. It's brilliant and it's deviant.
Okay, we've got our suspects and we know how they operate. So now let's trace the invasion pathway. We're going to follow the trail of evidence they leave behind, right from the moment of first contact all the way to the telltale clues that finally give them away. Now, this timeline for measles is absolutely crucial. First, you have this stealth phase, the incubation, for about 8 to 12 days. The virus is there, but you feel nothing. Then, the prodromal phase kicks in. For 2 to 4 days, you just feel, well, flu-like. But here's the scary part. This is when you are at your most infectious. And right in the middle of that window, for a tiny, tiny period of just 24 to 48 hours, the smoking gun clue appears. And it often shows up before you even see that classic rash. And that clue is something we call pathognomonic. Now, that's a key piece of jargon for any medical detective. All it means that a sign or a symptom is so specific to one disease that if you see it, the case is basically closed. It's the definitive piece of evidence. It points to one suspect and one suspect only, no doubt. So what is this pathognomonic sign for measles? It's something called Koplik's spots. And here's where it all comes back to the dentist, because these spots, they appear inside the mouth, on the lining of your cheek, usually right across from your molars. The description is so specific. They look like tiny bluish-white grains of salt, each surrounded by its own little red halo. It's an unmistakable clue, but it's also incredibly fleeting. It can vanish in just a day or two. Now, our other suspect, mumps, is, well, a lot less subtle. Forget tiny spots, its signature is acute parotitis. That's the painful swelling of the salivary glands that gives you those classic chipmunk cheeks. And here's the really critical connection for a healthcare setting. That swelling means the virus is actively multiplying inside those glands, which turns the patient's saliva into a super contagious viral soup. Okay, and this is where our investigation takes a really dark turn. Because all that talk about these being harmless childhood diseases, that myth just shatters when you start looking at the potential aftermath, at the severe and sometimes absolutely devastating complications. Let's start with this number, 1 in 1,000. That's the rate at which measles leads to encephalitis. And let's be clear, this is not just a bad headache. We're talking about direct inflammation of the brain itself. This can cause permanent brain damage, lifelong seizures, or it can kill you. But believe it or not, there's something even more terrifying. It's called subacute sclerosing panencephalitis, or SSPE. It is a rare, always fatal, degenerative brain disease. And it's caused by a defective piece of the measles virus that just stays behind, hiding out in your brain long after you think you've recovered. The only way to describe it really is as a viral time bomb. And this is what is just so profoundly chilling about it. The time bomb doesn't go off right away. The onset is delayed 5 to 15 years after the original infection. Imagine that. A kid gets measles, recovers completely, lives a totally normal life for a decade or more, and then this ghost of the virus wakes up and just starts to systematically destroy their brain. It's horrifying. And there's another devastating complication, especially in certain parts of the world. It's called noma. It's a gangrenous infection that literally eats away at the tissues of the face and bone. It's this absolute perfect storm of what happens when a measles infection slams into a child who is already severely malnourished. The virus weakens the body, and bacteria move in to cause this just horrific destruction. Mumps isn't off the hook either. It has its own serious risks. Look at this number, 1 in 3. That's how many males who get mumps after puberty develop something called epididymoorchitis. That is a seriously painful inflammation of the testes and related structures. And in some cases, it can actually lead to testicular atrophy and sterility. It's a huge risk.
So, with stakes this high, you have to be absolutely sure of your diagnosis, right? So let's open up the forensic toolkit. Let's see how the lab detectives crack the viral code and get a positive ID on these suspects.
Basically, the lab has 3 main tools. First up is microscopy. You're looking for the virus's handiwork, right? The actual damage it does to cells. Then you have serology. This is where you check the blood for the immune system's response, looking for the specific antibodies that act like an alarm bell, screaming, recent infection. And finally, you have the gold standard, PCR. Think of this as getting a genetic fingerprint. It directly detects the virus's RNA. It's like finding the suspect's DNA at the crime scene. It's a positive ID.
And for all you real viral detectives out there, here's a detail you'll appreciate. Those giant damaged cells we see under the microscope in a measles infection, they have a name, Werthen-Finkeldy cells. Finding those is a classic telltale clue that your suspect is, without a doubt, the measles virus.
So after all this, after looking at how these viruses work, the paths they take, the horrible complications, and how we diagnose them, it all funnels down to one single, inescapable conclusion. Since there's no cure, the only real verdict is prevention. And this really is the sobering truth of it all. Once you are actively infected with measles or mumps, we don't have a magic bullet. There is no specific antiviral drug that can stop them in their tracks. All we can do is provide supportive care, manage the fever, help with the pain, and just hope your body can win the fight. And that is why stopping them before they could even start is so absolutely critical.
So what does our strongest defense look like? It's all about layers, especially in a place like a dental clinic where those first clues can pop up. It starts with just being vigilant, evaluating every patient's medical history. Then you have your physical barriers, your PPE, masks, gloves, the works. You've got to break that chain of transmission with relentless disinfection and sterilization. But after all of those layers, the evidence is just overwhelming. The single most powerful, most effective tool in our arsenal, the ultimate defense, is immunization.
It really makes you think, doesn't it? The fact that a routine checkup can be the first line of defense against a really dangerous systemic disease, it just makes you wonder, what other huge connections between different parts of our health are we just missing? What other clues are hiding right there in plain sight, just waiting for the next sharp-eyed detective to piece it all together?